My name is Zorina Galis. I am the Chief of Vascular Biology and Hypertension at the National Heart, Lung and Blood Institute. And I chose to address the audience of the International Academy of Cardiology this year, talking about what we might do as a result of the new developments in the field of clinical research in hypertension. My talk is entitled QUO VADIMUS, which is asking the question, where do we go from here? So just to briefly summarize, all of you are probably aware with the problem that we face in the war against hypertension, which is a very widespread condition in the United States. It affects over 80 million people, estimated over 80 million people. And the prevalence depends on age. It increases all the way to over 80% in older patients. Also depends on genetic background, sex, and other characteristics. The idea is that we would like to treat hypertension and control hypertension, and the question is, what are the correct guidelines? The most recent guidelines that have been published by the Joint National Committee number 8, also known as GNC 8, indicate first the definition for hypertension and then the goal to treat people based on the systolic and diastolic blood pressure to goals of 140 and 80 millimeter of mercury. The question remains, though, whether this is exactly the perfect goal for all of us. And one of the recent studies that was concluded, that was funded by the National Heart, Lung and Blood Institute, that made many headlines, called SPRINT, indicated that actually intensive control of hypertension to a value of 120 millimeter mercury brings a significant benefit in terms of composite cardiovascular risk. So in fact, the study has been planned for 6 years, but ended up being closed early due to the fact the effects were so visible that we considered unethical to continue to this study. So what this showed again is that if patients are controlled to 120 millimeter mercury systolic pressure, there is a significant decrease in the composite cardiovascular outcomes. And by doing this, it actually raised the question whether we should change guidelines and a variety of other questions. And the topic of the talk today is asking, where do we go from here? So many people who know me and who are interested in translation probably realize that such a momentous event makes us think both about how we move forward towards implementation and how we might need to go back to the bench to explain the very important findings. So moving towards the implementation, the question is, would a real-world trial in which the patients are having their blood pressure measured in regular offices, medical offices and practices benefit from the same intensive blood pressure control? Should we change the guidelines then and even change the definition of hypertension? Maybe people should be considered as having hypertension at a lower level than today. The other findings of the trial, which has been widely discussed, and I don't want to go back to that, also showed that there were effects on kidney function. And so that also raises a question about the risk-benefit balance. So the fact that we have such high effects would prompt scientists to go back to the bench and find out what are the molecular and physiological mechanisms that are responsible for the benefits. Coming from the NIH, I want to encourage the audience then to go both forward and backward in the translational continuum to benefit from the results of the trial, and to remind you all that we are very interested in promoting research in hypertension. I will show several initiatives that have been driven by our institute that are looking at new mechanisms of hypertension, including those that usually occur at the intersection of expertise that may or may not be examined by people who usually stick to one or the other expertise. For instance, we had a very good response to our initiative to combine the question of whether epigenetics plays an important role in hypertension. We also look at the relationship between arterial stiffening and hypertension, both at the basic science level, translation and clinical level. We are interested now in the role of the microbiome in hypertension and so forth. In fact, our institute has opened a worldwide initiative asking the question, are we pursuing the most important scientific and research goals that we could be pursuing? And we had a tremendous response from all over the world, and the results are going to be published very soon, so stay tuned to see what is the new strategic plan that the NHLBI is going to put forward for the next 5 years. I am looking forward to receiving continuous input, and I'm looking forward to the discussions at this meeting specifically, which brings together people from various expertise, and regardless of where they come from, they all can contribute to the field of hypertension, which is such a worldwide spread condition.